Here's an example of these so-called improved stoves. You might, just looking at them, you might doubt if they're working. Obviously, there might be a chimney there, but a lot of the smoke is not going up the chimney. We also found something else that relates to, directly relates to John and my overlap, so to speak, and that is where does the pollution go? It goes out of the house. It doesn't disappear magically. It's around. And the levels in villages, outdoor levels, can be really substantial. Sorry, this is different units here. Multiply this by 1,000. So that's 1,000 micrograms. Remember, the standards are down here around 100. And look at this. I just took the device, started out in the fields during the cooking time, walked into the village. I didn't go into any house, just walked between the houses. And look at, we're getting, hundreds of micrograms per cubic meter outside. So that's how we actually don't call it, I don't call it indoor air pollution problem anymore. Might start in the indoors, but it certainly doesn't stay there. So let me tell you a story of my life, in a sense, in this field. It was going to two conferences. I go to an air pollution conference, and I present some of these numbers, and they look at me sort of aghast. Good Lord, that we know their health effects 20 times less than you're finding. You're dealing with the most vulnerable population, women and children in the poorest households. You don't need to do any more health work. Just go out and fix it. And so I get charged up, and I go across the street to the International Health Meeting, and they say, look, I've got $10 per year per capita to spend in India on public health. Are you telling us to take money away from vaccines, antibiotics, maternal care? By the way, we don't even reach the whole population with those yet. And put it into, clean stoves? And I say, well, no, maybe I'm not saying that quite yet. We need to know the exact, we don't care what you found in Guatemala, we need to know it in India. We have to know the exact benefit you're going to get. Because we can't take $1 away from that $10 to do something unless we know we're going to get something from it. Or you go to the Gates Foundation. Now, the Gates Foundation, rich place, but $1 a year per capita in India, that's $1 billion. It uses up, the entire budget of the Gates Foundation. They want to know the same thing. So ironically, again, in the places with the most need, the most risk, have to have the best data. And then the next question they ask is, where are your randomized controlled trials? This is what the health community expects, to actually show what you can actually get with a real intervention. And you can understand. So, this is the title, published title of this, Following the Risk, Not the Money. And we did the first measurements in 81. We had a little meeting in 84 to see some colleagues, Peter Kunstetter, who's here somewhere, was one of the colleagues at this meeting, and to decide what to do with this. And we decided, well, the thing to show the world what was going on was a randomized control trial of pneumonia. Child pneumonia is the chief cause of death in world's children, and we think, well, now we know, but we thought then was probably caused by the smoke. All right, so how long do you think it took us to get funding? Well, we tried for several years in Nepal, couldn't get funding. WHO never has enough money to do big studies, but they had a committee that helped us find the best site. We visited 9 different sites around the world and chose Highland, Guatemala as the best site. More proposals and pilot work. Finally got funding in 2001. 17 years between deciding to do this and getting funding. No, we weren't obviously following the money. Main published results last year. So I don't even want to do that calculation. A lot of time between the deciding to do this and final publication, or not even final, we still got other things coming. There's the publication in Lancet last fall. All right, I'm not going to go through the whole thing. I mean, you might be interested in the site. Some of you may have traveled to Guatemala. It's in an area near the Mexican border, near Quetzaltenango is the big city, place called San Lorenzo. This is what we did. This is the typical situation. This is the most common cook stove arrangement in the world. 3 rocks, it's called, or 3 bricks sort of thing here. A mother cooking with a baby on her back. And this was the intervention we put in randomly. Chimney wood stove, very well liked by the population, and when maintained, very good at reducing the indoor air pollution. So we'll put that on our timeline. That was when we decided to do it, and that's when we got the funding. And that's when we got the publication. Oops. So we also wanted to measure exposure, because in one sense it doesn't matter what the concentration is, you really care about what people are breathing. So not so easy to measure exposure, a personal device like that pump, you can't put that on a baby, so we had to develop techniques for measuring exposures even on babies. This is not a baby, but you can see this device can even be worn by babies. So that took some time to develop and validate that. And we found, bottom line here, is that infants with a 90% reduction in the exposure had a 50% less pneumonia, which is the chief cause of death in the world's children. Now, that's much better than you can get with any available vaccine, nutrition supplements, antibiotics, or whatever. So it's big result. Now, one study, not going to convince everybody right away, and there are two other ones now, one in Africa and one in Asia. And I'm an advisor, but not an investigator on those. But we learned something else. We learned that the chimneys caused the kitchen levels to go down by a factor of 10, but the average child exposure was only down by a factor of 2. Now, some kids had a greater increase in exposure, but the average was only a factor of 2. Why? Well, kids don't spend all day in the kitchen. They did, their exposure would go down by a factor of 10, but they don't. And the neighborhood pollution, or chimney, doesn't get rid of the smoke, it just moves it around. And so, for example, there was no significant difference between the two types of houses, with the chimney stove or the non-chimney stove, in the bedroom or the outdoor level. So the average kid benefited, but didn't get the full benefit. That factor of 10 was an unrealistic expectation in terms of the change in actual exposure. So as a result, my group, anyway, doesn't work on chimney stoves anymore, unless they're combined with good combustion. Get rid of that smoke in the first place. Don't have all that stuff being converted, that nasty stuff. Don't just plan on moving it around. And here you can see, this house doesn't have a chimney, but you can see the smoke got to go somewhere, right? In fact, where does it go? Here's another view from our site in Guatemala, early in the morning. Quite common all over the world. And those 40% of households, there's going to be something like this going on. So where does it go? Well, it goes into John's databases. Here's another view of the global situation, 20-month average ground level PM 2.5. Somebody has converted these satellite measurements into some estimate of ground level. I don't want to go through it in detail, but look at these high levels in the big river valleys of India and China. What is that from? Those aren't cities. Sure, there might be some smoke coming from the cities, but there may be some brick kilns and maybe some agricultural burning and things, but a good portion of that is households, densely populated by agricultural standards. Households burning stuff incompletely. Not surprising when you think about it. In fact, if you've ever driven through those areas in northern India or China, it looks like LA. Highly polluted. People think of rural areas as somehow magically clean. They're not, at least in this part of the world. How big are those? How big is it? Well, we don't, in fact, John and I are talking about a joint proposal, sort of triggered by our joint prize winning here, about actually pinning this down, adding his work on secondary aerosols. So I don't have secondary aerosols. This is primary aerosols based on NASA inventories. And about 50% of all particle air pollution, primary, in India from households, 30% in China. Not much bigger than transport. But there's another part of the particle picture, and that's the secondary, and we need to pin that down. But anyway, not a small actor, let's put it this way. A significant actor in outdoor air pollution in these countries, not just indoor or household. So now I don't have time to go through this, but we actually started doing some measurements related to the climate impacts around 1990, and I'll show you somebody else's models for this. This is a group at Columbia University, the NASA Goddard laboratories there. They made estimates of the total climate impact of different economic sectors. Now, this is complicated work to do. Models, assumptions, so on, presentational issues. But here's the vehicles. This is basically vehicles. And it shows, the only thing on the left is the cooling impact of that sector, from sulfate particles, for example. and things on the right are the warming, and this is ranked by the net impact, the highest being their estimate on road, second being household biomass use. And you can look for other sectors down here. Now, as I say, this is complex stuff, a lot of assumptions, even the metric, and then they chose a particular year. Different year, you might get something different. So I'm not going to argue that it's second, but I'm just going to say it's up there with the big boys. You can't deal with climate change, effectively globally unless you deal with get household combustion. And I'm saying the same thing. You can't deal with outdoor air pollution, at least in those parts of the world, without dealing with household combustion. Indeed, what do you think is the chief cause of air pollution in the Bay Area, San Francisco Bay Area, where I come from? Wood smoke from fireplaces, and not much cooking with wood smoke, wood. Chief cause in all of Canada. Chief cause in Denmark, Sweden, Finland, and Norway. Chief cause in Chile, Tasmania. So wood smoke from space heating or fireplaces is actually something that the developed countries shouldn't be very proud of because we haven't dealt with it very well. But of course, it's not at the scale in terms of risk as when you're cooking with it. Now, I don't have time to go through the evidence based on the epidemiology and the health effects. I'll list some of the diseases later, but the next part of this story is in 2004, the World Health Organization did this so-called comparative risk assessment, which is by far the most comprehensive thing of this type. And they compared all of them, actually 26 major risk factors. I put a number of them here. And the metric here is DALYs. This is lost healthy life years. It's better than deaths. Everybody has to die. So you care about premature death, how premature, children count more than adults. They found malnutrition and measured as underweight as being the chief single cause of ill health in the world, followed by the HIV epidemic, and then high blood pressure, tobacco use, and so on. Here's the first environmental risk factor, unsafe water and sanitation. And here we were, number 10. Now, again, these aren't so accurate that you can really tell. I mean, that's probably different, but whether these are different or not. But up there with the big boys again, and this has certainly made a difference in terms of people paying attention to this. Now, if you like deaths instead, we can put in this is about 2 million premature deaths. You should always say premature. You cannot prevent death. I'm sorry if that's news, but about 1 million. But notice this was urban. And the new assessment that's coming out this year will actually include rural, and it makes it much bigger because of all that rural outdoor air pollution. And now, let me ask you, part of my leaving the money and going to the risk was the first part of my career. My dissertation and early parts of my working career were related to nuclear power, nuclear risks, reactor safety, nuclear waste, and this kind of thing. And it's a natural place to go if you're a physicist. It's kind of technically sweet, I think as Fermi said. But if you train yourself to follow the risk, well, that's why I moved to household air pollution. But then the Fukushima accident last year caused me to think about this a bit more, so I thought I'd maybe put it in this burden of disease context. So I said, well, what if you had a very large nuclear power industry in the world, say 5,000, 7,000 reactors, something like that, and you had one Chernobyl accident per month. Now that'd be, hard to imagine a worse situation than that. Chernobyl was far worse than Fukushima. 95% of the radioactive material was burned and sent some of it into the stratosphere. No containment, no evacuation, no iodine pills. Terrible. Well, big studies have been done now on the health assessments, and these assessments can always change over time. And I'm not talking about what you might read on the web. I'm talking about authoritative assessments. So if you had 12 of these a year, how would it show up on this graph? Is it up there? Is it in here? Is it like malaria? I mean, what is it? Well, there's Chernobyl. So, confirms my switch back in the 80s. This risk is a lot bigger.